Good morning. Welcome to Movement with Purpose. My name is Barb Eisenberg. I'm a physical therapist assistant and also a licensed massage therapist. I work with therapy at home and we provide therapy services, including physical, occupational, and speech therapy services. So I hope you will check out our website and find out if there's any way that we can help you. The website is tahcares.com. So tahcares.com. Check us out. So we have been talking in the last few videos about making positive changes. We started a new year. We want to go into this 2021 year making positive changes to help us continue living the best that we can with a great quality of life. We talked about hydration, how important it is to drink water because our bodies are very much made up of water. So every cell in our body, every tissue, every organ, every system in our body, digestion, muscular activity, your joints need that hydration. Every single, your endocrine system, every single system in your body needs that water to function at its optimal level. So keep drinking the water throughout the whole day and you will feel much better. We also talked about home safety. I had an injury recently. I bashed my toe on a box because I did not have a clear path walking through my house. So make sure you keep your home safe so you don't have any accidents. It's a very common thing to happen, to have an accident in your home. So today we're switching gears and we're going to talk about arthritis. Why? Well, arthritis is the leading cause of pain and also of disability, actually worldwide. Arthritis is a big problem for many people. So there are many types of arthritis. There is rheumatoid arthritis, osteoarthritis. Gout is also a form of arthritis, usually affecting the feet and the big toe. Psoriatic arthritis is a type of arthritis associated with psoriasis, which is a skin condition. Lupus is also a form of arthritis, and fibromyalgia is another form of arthritis. So lots of different types, but the most common that you'll hear about are osteoarthritis and rheumatoid arthritis. So we will focus on those two, and I'm going to talk about both of them and how they contrast and compare. Osteoarthritis usually occurs after about the age of 40. Rheumatoid arthritis can happen anywhere from the age of 15 all the way up to the age of 50. It can start. Osteoarthritis is usually results from stress on a joint, so a repetitive motion, something that you do in your job over and over again, or a repetitive action in a high-impact sport like running or tennis or something like that. Rheumatoid arthritis has a large genetic component, but it's also considered an autoimmune disease. So that just means that our bodies are acting in a way that it's attacking itself and causing some inflammation in our joints. Osteoarthritis results from that stress, and it's degradation of the cartilage in the joint that works to really connect those two surfaces of two bones together. When that cartilage is degraded, that connection is not as stable, and you might form some bone spurs in that area. So you might start hearing some noises that those bones start rubbing. With rheumatoid arthritis, it also affects the joint, but it's an inflammation in the joint, and specifically it's inflammation in the synovial membrane and the joint capsule. So with osteoarthritis, it usually only affects a few joints. With rheumatoid arthritis, it can affect many joints, usually more widespread. It can affect the spine, shoulders, knees, hands and feet. Sometimes you'll see pretty severe deformities in the joints of the hand, so it's more obvious when someone has rheumatoid arthritis. And both of these conditions result in usually when you wake up in the morning, you're usually kind of stiff. With osteoarthritis, it usually Feels better after about 30 minutes of moving around, getting the blood pumping, getting the fluid moving in the joints. With rheumatoid arthritis, there's swelling, redness, and sometimes warmth in the joint, and it can often last longer than 30 minutes. So both of these conditions can result in pain, can also result in loss of range of motion, so not being able to reach as far or bend as far as you used to. It also can result in weakness, because if you're trying to protect that a joint from pain, you're not going to move in the same way, and your muscles may become weaker and weaker and atrophy. So how can we manage and treat these conditions? Number one is you want to manage the pain, and there's lots of different ways to do that. You can use over-the-counter medication. You might need something stronger. You might need to ask your doctor for a stronger medication if the over-the-counter doesn't work. Many people find relief just from using exercise or activity to help reduce the pain. Many people find relief with acupuncture, with relaxation techniques because of that mind-body connection. Relaxation techniques help reduce pain quite often. Having social support is very important. So you have to find the things that work for you. Mobilize your joints every single day. Try to move every joint as much as you can. Fingers, ankles. We'll be doing a lot of that today. Hips, knees. So as many joints as you can. Try to think about moving them in all different directions. But when you're moving your joints, you want to make sure you stay in your comfort zone. So that means you're moving them in a way that doesn't cause pain or increase your pain. All right, using good posture is also very important. And when you're active, we want you to find activities that are low impact, so stay away from the jumping and running, but lean more towards things like cycling is a great activity. Walking is a nice low impact. Water aerobics or any kind of movement in the water. You can walk in the water. You can do swimming is a wonderful activity. You're almost weightless when you're in the water. And sometimes they have a special pool that's warmer, so that's going to feel better on your joints. Heat and cold is also another type of treatment that people use to deal with their pain. So I hope some of these ideas help you with your arthritis if you've been diagnosed. So to review, manage your pain, mobilize your joints every single day, and be active. Keep moving. That's what we're going to do right now. So I hope you'll join me. We're going to have a seat and get moving as many joints and muscles as we can. And we always start with a warm-up. So have a seat, sitting nice and tall, working on posture, so strengthening our back and our shoulder muscles. And we're going to start lifting one knee up and lifting the other knee up. So alternating knee up and knee up, up and up and up. Sitting tall, up and up. When you sit tall, you feel the core engage. So you're working your stomach muscles. And deep breathe. Start connecting your mind to your body. Think about what you're doing. Think about what muscles you're using. You need your mind to activate your muscles. Very important. All right, we're going to switch it up and go out with one knee to the side and bring it back in. Same leg, out and in, out and in. One more. Out with the knee, in with the knee. Other side. Out and in, out and in, out and in. One more. Out and in. Now we're going to switch back and forth. So out with one knee, in, out and in, out and in, out and in. Good job. Out and in, out and in, out and in, out and in. Now we'll go back to lifting a knee, but we'll do 3 in a row. So up with the right for 3, 2, 1, and up with the left for 3, 2, 1. up with the right, 3, 2, 1, and up with the left, 3, 2, 1. Let's just do a little bit out with the knee, in, just a few of these, in, out and in. One knee, out and in with the other knee. 3 more, 2 more, and 1 more. All right, so we got the hips loosened up. Let's go to shoulders and elbows. We're gonna reach out like we're grabbing the oars of a boat and pull back. So trying to get your elbows behind you. Reaching out, you can stretch out your fingers and then pull back, making a fist. So you got fingers and you got shoulders all working. Reach out, pull back, reach out, pull back. Reach and pull, reach and pull. Reach and pull, reach and pull. Deep breath and blow it out. Reach and pull. And let's go 3 more, 2 more, and 1 more. Now let's go 1 and same side. 3, 4. 1 more with the right. And switch to the left. Reach and pull. Reach and pull. Reach and pull. And 1 more, back to doubles. So reach out and pull back. So when you're reaching with 2 arms, you really have to engage your core to hold you up. Reach and pull. Reach and pull. Reach and pull. Good job. Reach and pull. 3 more. 2 more. 1 more. Shake out those shoulders, do a couple circles, and we'll go 1 elbow, touch your knee. Elbow, same side, touch your knee. Elbow, touch your knee. If you can, get as close as you can. If you can't, just go in that direction. And switch. Other elbow, reach toward your knee. So you're lifting up your knee and you're doing a little bit of a twist. Reach, trying to touch that knee. So you're really working your core. And switch again. So right elbow toward your left knee. Cross. 2. Let's go for 8. 3. 4. 5. 6. 7. And 8. Good job. Other elbow, stick it out. Reach it across to your other knee. 2. 3. 4. 5. 6. 7. And 8. Good job. Let's go 4. Right side for 4. 3. 2. And 1. Left side for 4. And 3. 2. And 1. Now for 2. 2. And 1. Other side. 2. And 1. Good job. All right. We're going to go arms straight out and we're going to fly like a plane. So arms straight out and just tip to the side. Keep everything level. Come back to center. Tip to the side. And back to center. Really engaging the core, but also working your shoulder muscles. Even though you're not moving them, just holding them up is engaging those deltoids. Good job. Tip to the side. Back to center. Side. Back to center. Side and center. Side and center. If this is too hard, you can put your hands on your shoulders, still tipping to one side and the other side. Really working the core. Side and center. Side and center. 3 more. 2 more. And 1 more. Good job. Deep breath in. Blow it out. Going back to legs. So I'm going to turn sideways. You want to lean back. And we're going to kick. Pretend we're in a pool. And we're going to kick like we're trying to splash. Kick your legs. Knees are straight. And we're just kicking for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Deep breath in, and we're going to ride a bike. So leaning back again and pedaling for 10, 9, 8, 7, keep pedaling, 6, 5, 4, so feet are going in a circle, 3, 2, and 1. So really working hips, working core. Anytime you're leaning back and you're lifting your legs, you should feel that core engaged, those stomach muscles. All right, moving down to the ankles. So feet flat on the ground, and then lift your heels up. Try to lift them as high as you can. So really working the calf, and lift the heels up. 2, 3, 4, 5, 6, 7, and 8. 8 more. 8, 7, 6, 5. Really pushing it into the ground. 3, 2, and 1. All right, feet flat. This time try to lift your toes up. This is harder. Lift your toes. Lift. 2, 3, 4, 5. Working the shins. 6, 7, and 8. One more time. 8, 7, 6. Trying to sit tall. 5, 4, 3, 2, 1. That gets tiring. I'm surprised. I can feel it in the front of my leg. Good job. Now we're going to work a range of motion. So legs straight out in front and circle with your toe. So we're working range of motion of the ankle joint. Trying to keep it nice and fluid. You work in your comfort zone, so if you feel pain, then back off a little bit and circle the other way. Circle with your toe. Circle. 3, 2, and 1. Good. Other foot straight out, toes pointing up, and make a circle with your toe. Knee is straight. Try to go as far as you can in every direction. Circle, and circle the other direction. Circle around. Good work. Keep circling. And then both feet up and just go up and down for a few. 5, 4, up and down. 3, up and down with your toes. 2, and 1. Good job. Now we're going to do some kicks. So with one leg, kicking out, engaging that quad muscle, that thigh muscle, and we'll go 8 with the right. 7, 6, 5, 4, 3, 2, 1. So we're going for power. Really kick hard. Left foot. 8, 7, 6, 5, 4, 3, 2, and 1. Back to the right for 8, 7, 6, 5, 4, 3. Kick hard. 2, 1. And the left for 8, 7, 6, 5, 4, 3, 2, and 1. Let's go back and forth for 8, 7, right and left. 5, 4, 3, 2, and 1. Good job. We're going back to shoulders and tricep. This is muscle underneath your arm. might be a little flabby. As we get older, we want to keep it nice and strong back there. So we're going to push straight out in front, really pushing away, and then push out to the side. Push to the front and out to the side. Push front and push out. Push front and push out. Now let's push up to the ceiling. Like something's gonna fall, you gotta push it away. Push it away and then push to the front. Push to the ceiling. Push to the front. Push up and out. Push up and push out. Keep going. Push and front. Push up, and you can look where you're pushing. 3 more. And up 2 more. And 1 more. Push front. Shake out those shoulders. Sit up nice and tall. I'm going to reach as high as you can with one hand. Reach a little farther and then over to the side. Up and down. Again, same side. Right arm up. Reach a little higher. Reach over and down. Reach up. Reach over to the side and back and down. Reach up. Reach out a little higher. Feel it in those ribs. Over to the side. Really working the core, working the shoulder. Other side. Left arm reaching up. Reach higher before you stretch over to the side. And then up and down. Reach up. Reach higher. Over to the side. Really engaging those side muscles. Up and down. Reach up. Reach higher. Over to the side. And down. Reach up, reach higher, over, and down. 1 more. Reach up, over to the side, up, and down. All right, back to shoulders. So we're going to start, so we're working the top of the shoulders and the back of the shoulders. Starting, these are deltoids and upper back, trapezius. So arms straight out in front, reaching straight out and straight out. We'll keep going. Reach out and reach out. Let's pull back and then reach out. Good, pull back. So we're really trying to pull the shoulder blades together and then out. Sitting tall. So we're engaging the core. Pull back, reach out, and pull back. Reach out. Just a few more. Reach out and pull back. 2 more and back. And 1 more. Pull back. Shake it out. Good job. Let's stretch out those shoulders that we were just working. So cross your arms over, give yourself a hug, and tuck your chin. Pull. Stretch out that back. And then open wide. And cross over the other way. And round your back. Tuck your chin. Really feel it in your upper back and shoulders. Come up and relax. Now we'll stretch out the legs. So one heel out in front. You want to bend from your hip joint. Toe is pointing up to stretch out the calf, but also the hamstring. We're going for the hamstring. Coming forward with your chest. Bending here, not rounding your back. So chest is up. You can lean on that other leg. And breathe. Feeling a stretch in the back of this leg. Very important. If the hamstrings get tight, oftentimes you're going to feel tension in your lower back, and sometimes low back pain comes from tight hamstrings. So if you do feel some tension or low back pain, try this hamstring stretch. See if it helps. Bring that foot back, other leg out, toe pointing up, knee is straight, bending from the hips, chest comes forward. You can lean on that other leg. And deep breaths in and out through your nose. Really pulling that toe up. One more deep breath. And blow it out. Good job. And we'll do a back stretch. Hands on your thighs. And lean forward. Just try to lay right on top of your legs. Stretching out the back. Let your head hang. And breathe. And then deep breath as you come up. And blow it out. Make sure you come up nice and slow. If you come up too fast, you could get a little dizzy. So hands straight out in front. We're going to go up and down with the wrists. So work on the wrist joint. Up and down. Up and down. Now make some circles with your wrist and circle the other way. Work at every joint that we can. And let's stretch out the fingers a little bit, one finger at a time. If you feel any pain with this, then just move on, do something else. So a little bit of a stretch for each finger. Give each finger some attention. Just a few seconds, each finger. Don't forget the thumb. And then in and out, make a fist, stretch them wide, fist, stretch them wide. Good job. Let's go fast for 5, 4, 3, 2, 1. Good work. Onto the neck. So let's make a circle, starting with a small circle, stretching out the neck. Really trying to work as many joints and muscles as possible. We don't want any single joint to get old. And circle the other way. Looking up and over, down, and to the other side. Up and over, and down, other side. Good work. One more time, over and down, over and up. Sitting tall, working on the stretching out the chest or the pectorals. Hands behind your head. Bring your elbows in and out, in and out, in and out. One more, and we'll hold. 5, 4, 3, 2, 1. In and out, in and out, in and out. One more, and we'll hold for 5, 4, 3, 2, 1. In and out, in and out. Last time, in and out. And hold those elbows as far back as you can for 5, 4, 3, 2, 1. Deep breath in as you reach up and blow it out. Let go of any tension. One more time, reaching up. As high as you can, big stretch, blow it out. Thank you for joining me. This is Movement with Purpose. I'm Barb Eisenberg, and I hope to see you next time. Bye-bye.